hopefully everybody who wants to be here is here already. So perfect.
Okay, we'll go ahead and get started. Welcome everyone to the first statewide adult committee meeting of 2022. I cannot believe it's 2022. And I'm actually impressed that I have not been writing 2021 on anything. 2021's a blur, I guess. My name's Kirby Fye. I'm with the department. Just a few things to go over. We're continuing to meet per the Open Meetings Act virtually in order to keep everyone safe, especially with this new variant going around. So with that being said, the meeting will be recorded and it will be posted to the department website within the next day or two. Please make sure your phones and or computers are muted if you're not speaking or asking any questions. It just prevents any feedback from coming through. And if you do make any comments or ask any questions, please state your name before doing so. It's helpful when capturing the minutes. I'm going to go ahead and go through the attendance, starting with the individuals who have joined via computer first, and then I'll take the attendees of those who have called in. So like I said, my name is Kirby Fye. I'm with the department. We have Albert Richardson, Allison White, Amy Holland with the department, Avis Easley with the department, Beth Irwin, Candace Allen, Debbie Hillen, Evelyn Jurgen, Ginger Nazary, Jan Cagle, Kurt Hipple with the department, Sam Slagle, Trish Cunningham, Vonda Wagner, and then I see three individuals who have called in. The first number is a 423 number that ends in 3311.
Paul Switchcar.
Hi, Paul.
Happy to be here.
Welcome. The second number is a 615 number that ends in 1832. Okay, how about the 850 number that ends in 1319?
Yes, this is Elisa Lapolte with NAMI, Tennessee.
Hi, Elisa. The remaining caller, can you state your name, please? Well, we'll just come back around. All right, handing it over to you, Ginger.
You're on mute,
Ginger, you're muted.
Okay, you told us to mute. So
sorry.
That's okay. I always forget to unmute. Happy New Year, everybody. It's a cold and sunny day in Northeast Tennessee, and I hope your weather's good. It seems the New Year started out pretty cold. We had snow day on the first day coming back after the New Year, so we had some delays on January 3rd, but we're all back and working, and my goodness, there's a lot of work to do. Lots of things out there, and our job today is to start talking about our needs assessment and figuring out what our priorities are, so we can move that forward to the overall planning and policy council to be included in the needs assessment summary, and then to help influence the 3-year plan with the department. So just to review, I think Kirby sent out the needs assessment earlier. Of course, I had a hard time finding mine. She had to resend it. So, and Kirby, were you going to share your screen as well?
Yes, I'll do that right now.
Okay. And so,
also, just a quick reminder that I think I mentioned it at the last meeting in October. We have 4 needs from 2021, but now we have the option of submitting anywhere between 2 and 6 needs, so 2, 4, or 6 needs, so long as they're equal representation of substance abuse and mental health. Just wanted to remind you all of that change.
Yeah.
And I'll share this. You're welcome.
Thank you for that reminder. So we can go up to 3 in each category, if I'm understanding that correctly. So just to remind folks, from last year, we had 2 mental health needs, and the first one was to hopefully focus on housing opportunities such as transitional housing and respite services to aid the homeless or potentially homeless individuals with mental health disorders being discharged from hospitals, EDs, or the jail, with special provision to support individuals who may need supervision and support to live successfully in permanent housing, but may not require group home type settings. So I think that was one of our mental health needs. And the other mental health needs was to enhance workforce development, which will allow for providers to obtain and retain psychiatric providers and licensed therapists. Just to stick with the second one first, I think we have seen some progress in that area. There was a special committee developed to focus on some initiatives for workforce development and to try to move that forward. I know some of those steps are already in place, and that's involved the department as well as TennCare and the individual MCOs. So I think we've made significant progress on that. I certainly would want to thank TAMHO for some of their data because that was very helpful, I think, in pushing the agenda forward. So, you know, one of the things I think the department has emphasized over the course of time is collaboration is what makes things work and makes things move forward. So certainly that was a collaboration of voices that moved forward. Are y'all of the opinion that we don't need to escalate this need anymore? I know sometimes we have the same need for a couple cycles because we're really trying to emphasize the need for it. What are folks' thoughts about needing to keep this one on here, or do we think the ball is rolling enough that we can start focusing on another need?
Ginger, hi, this is Candace. I'm not sure that we don't need to keep it in some form because I'm not sure how all this is falling out into actual day-to-day impact on behavioral health centers across the state. I don't know if we've got enough, data as a result of these. I mean, I do think that there was some response, I agree, but I'm not sure if we know to what degree that's going to impact.
Okay.
Not saying that we don't appreciate anything that we can get, but I'm not sure how that's really going to play out realistically. So I'm on the fence, but just want to kind of start that conversation.
Thank you, Candace. Feedback from others, please.
This is Debbie. Having done housing for many years, I don't think you can ever have enough based on what's going on these days. I do have the one concern because I know oftentimes, whether it's the department or whether it's HUD, they put very specific requirements or targeted population to serve. And I know this last pot of money that came out had to focus on those being discharged from jail or prisons. Mm-hmm. And that's a need. However, what about Joe Blow or Sally Sue over here, who has just run up on bad luck? Where's their housing? So I think as we go through, if there was any way to not put as many restrictions on the targeted population, yes, mental health, yes, substance abuse, but not to target it down to one targeted population. I don't know if that makes any sense. Mm-hmm. But I found it got hard, and it is hard to put somebody in housing.
Okay.
Quack like, and talk like. So some degree that I agree with whoever was before me, that there still needs to be housing, but it needs to be a little bit more open as far as the targeted population.
Okay, I'm taking notes, Debbie, and I may reach out to you to finesse this a little bit as we move forward. They need to be more open about specific target populations. Okay.
And unless they've changed it, HUD will do a point in time the last week of January.
Yeah, I did actually. This is Ginger again. I did see for Northeast Tennessee a call for volunteers for that in our region this week. So they're trying to get those volunteers up and trained. So that'd be helpful to have some data to support what we talk about. So we think we need to continue to focus on permanent housing opportunities. And I know for another point that the department has done is they have expanded one position, a consumer housing specialist position, to hopefully broaden opportunities to build relationships in the community that could end into housing opportunities for people. So I know that's one thing that's been added. But like Debbie said, there's still a lot of homeless hanging out there and a lot of people with mental health issues that need shelter and support. Any other comments or concerns about the mental health needs, the housing needs, and enhancing the workforce? So what I'm also hearing being said about enhancing the workforce is that maybe we need to leave it on there because we don't have quite enough data yet to see if the initiatives that were started have been successful. And so any comments to that we need to leave that on, or thoughts about that?
This is Evelyn, and I have a comment on the housing piece.
Yes, ma'am.
I think we have really advanced when it comes to getting the independent housing for people and getting them, but we still have that cluster of consumers or clients that need a level of care like great group homes. They can't care for themselves in the community, and we've tried, and we've not been successful because they can't cook, they can't remember to take their meds, they can't keep their hygiene up. They need the support of something like a group home, and I don't know about other regions, but here in Metro Davidson County, licensed group homes are shrinking, and the more they shrink, the more we need them. So if we could look at that in some capacity of how we can house people who do need a good group home, a good licensed group home.
Okay, so I've jotted down, Evelyn, and thank you for sharing that, because I do think sometimes that's might be regional specific, but the number of licensed group homes are shrinking. But we still have strong needs for people to need that kind of service support that independent living doesn't have, right?
Absolutely.
Okay.
I would say, this is Candace again, that is also a identified need. We've seen that as well, like in the Knox County area.
Okay.
The licensed group homes dwindling.
Maybe I can connect with the licensure department and actually see how the numbers have decreased, and that would support our data efforts.
Yeah, and I think, this is Candace again, I think what we see we've got we've had an increase of perhaps group homes or facility where someone can go if they have a substance use issue, but that doesn't always correlate with a real, solid co-occurring program. So we'll have someone that has some pretty significant mental illness issues in addition to the co-occurring, and there's just not the, it just doesn't go well, with the staffing and the knowledge to take care of kind of more of a complex individual, I guess, complex needs.
This is Jan with Region 2. So I know one of the issues that happens is that the person doesn't have insurance. So they have to be covered by insurance and have an income. And that is a huge barrier for people that are living on the streets, did not get to apply for disability or didn't re-up because they can't navigate the system or have been in jail and have lost their resources. So I think when we think about group home placement, it's not just that we need more beds, but we need people to have access to those beds. And I'm not sure quite how to articulate that in the needs assessment. I mean, I think we certainly should, but does that also go to legislative for like funding?
I'll work on finessing that, Jan, in some verbiage, and maybe Kirby and Amy can help me send a draft out to folks, and we can add some feedback back to it. But I know exactly what you're saying. Is there a way for us to have some support dollars that would get a person into housing and shelter and service while they could work on applying for the benefits that they may qualify for, and give them that stability, so then maybe they can then move to a increased level of independence, hopefully. So yeah, I think we can figure out a way to word that.
Okay. Great.
And shoot that back out to folks.
This
Okay.
is Debbie, and Jan, you're right on target with that, and Ginger, and your repeat back of that, in that it's one thing to have the brick and mortar.
Right.
It's another thing when you got to deal with that individual and all the stuff that they're bringing with them.
Right.
Getting them off the street and putting them in the house is important. But if you don't have those supportive dollars to support that person, and like you said, okay, maybe I don't have insurance coming in today, so this is not something that's accessible to me. Are there some housing that can be set up that would allow that easy entrance on the front end with some supportive dollars? And that goes back to the group home. Well, we don't run any group homes. I do know that there still needs to be a lot of support. And if you don't have coverage for it, you were talking about the group homes declining. Well, if the service dollars are not there to help them support their mission, then they're going to close those houses.
Right.
And so that's just an important part. That was a hard lesson I had to learn as overseeing 650 units of housing.
Mm-hmm. And Debbie, you're so correct. You're just very correct about that. They don't have support dollars, so they can't afford to stay open and do what we would like for them to do. And if we just need to build something, needs to be built that not only would benefit our clients and consumers, but it also needs to benefit the houses. We need to make sure we're supporting them in some way.
Absolutely. Hey, this is Shara, also with Region 5. One of the things that our region had talked about regarding this is looking at the houses that actually go through the process of being licensed through the state. So they meet the fire codes, they have the appropriate bedroom sizes, all of those things, but they're not contract, like 10-care contract homes. Looking at a way that those houses, because they have done the work and continue to do the work to meet those requirements to be licensed, way that they could then have additional compensation to help them not only like logically and logistically be able to maintain that level of housing and support, but also motivated to, because it is a lot of work for them to make sure that everything stays in compliance. The state does pop-up visits on them. They often are housing residents who may make false complaints to the state for a variety of reasons. So I think that's one thing that we had talked about. I think we also need to think about the population we have that they are able to get their mental health services through Medicare, through Safety Net, but they also have Medicare coverage and need the level of housing that we would send a 10-care consumer to for contract housing. That's not worded. I worded that very clumsily, but I've worked with many individuals who, if they had 10-care, they would be in a 10-care contract home, but because they only had Medicare, they had to go to something less supportive. And often we just see them struggle immensely with that. And a lot of times people that we have worked very hard to help get stabilized on medications, get their physical health taken care of, they then start to decompensate in that housing environment because there's just not the daily support.
Gosh, Sheriff Ginger, thank you so much. That's very very specific and about that unique population. And you're right. So many folks that have Medicare and may be eligible for a safety net too. We can't get them into group homes because we can't afford it because they don't have the 10-care copayment to help offset that. That may be happening. So I wrote it down. I'll try to morph it in there. May want to get a hand from some folks when it comes to how to redo that. And just as an aside, Kirby, we may want to think about asking Katie Lee to come to the adult committee and speak to some changes. I know they've been trying to be really proactive in making changes with behavioral health safety net, but maybe being able to share that in the so I'm trying to, because this discussion is great. We're already, let's see, my clock stopped. We're at 11:30, so or 10:30 y'all's time. So what I'm hearing, and I may need some help kind of summarizing this, so Candace, is that we can have 3 goals under mental health, or up to 3 goals. So one I'm hearing is there a way to, we know we need bricks and mortar, we need housing, but we also have the need for more services. So maybe we need to divide that into 2 goals and kind of focus on those in 2 different ways. And also to hold on to our workforce shortage issues until we see some more data and support under workforce shortage. That's kind of what I'm summarizing from what people have said so far. Can I get a heck yeah, Ginger, you're right on, or you're way off?
Amen. Amen. How's that?
Okay, that sounds good.
Yes, ma'am.
Thank you.
I think good to separate the housing issues out like that too, Ginger. That's a great idea.
Okay. So workforce. So now to focus a little bit, and again, our next meeting is in April, Kirby? Is it the final?
Right. I think it's,
Okay.
yeah, it's in April. It's after these are due because these are due on April 1st.
Oh, gosh. Okay. That kind of sucks, doesn't it? Excuse my language. That's kind of inopportune.
I know everybody, all the regional councils, all the statewide committees are all in the same boat.
Yeah. Okay.
Hey, Ginger, the next meeting is April 13th.
Yeah. Okay. Well, I'm just going to warn you guys to expect some emails with a request for feedback, okay? And Candace and I will really need to have that in order for us to really represent the group and what your ideas and goals are. I mean, we do want to be inclusive. We don't want to be, you know, Candace and I both have the privilege of living in East Tennessee. We don't want it all to sound East Tennessee. We really want to be inclusive. So, but we'll push for some stuff and ask for feedback, and we'll get it right before the due date of April the 1st. So, let's focus then for a minute, if we don't mind, on what our previous substance use needs were. Maybe they're relevant now and maybe not. But last year we had talked about increasing recovery housing to include peer run, recovery residents, halfway houses, and three-quarter housing options to hopefully support recovery and resiliency, and to increase education for treatment professionals about housing options. And then the other goal that we identified in substance use was to increase educational opportunities for communities about the prevalence and impact and resources regarding harm reduction, recovery, and reducing the stigma. So I think for the second one, we had talked about, we were seeing a lot more folks maybe utilizing drugs and alcohol as a way to cope with the COVID stress. And unfortunately, the COVID stress is still alive and well. And our drug-related deaths are still very high. Any death is one too many, but they still are very high. And so I think we were hoping to figure out some ways to address that. And then of course, housing in substance use is the same. Debbie, I know that's your area of expertise. Again, I think you said it earlier, it's something that's a need that's here to stay one way or another.
It is, Ginger, and this is Debbie. And one of the things is I sat here and I read and I looked at it. A lot of what we said about housing up and under the mental health category is applicable to this one, and that is the supportive service piece to it. Halfway houses are licensed. Out of that group, that's the only group that requires a license by the department. And so there are certain standards and certain things that has to take place there. What we run into is if we have somebody who needs to go into some type of recovery residence, I can't get them in. It's not that they don't want to take them for the most part, except my MAC clients. But the other is they want a deposit, they want first month, last month rent. And these people coming out of treatment or coming homeless, coming off the streets, well, first of all, they burn all the bridges with their families. And so you can't get them in. If I wanted to get them into a place that I really like because I like the management of it and what they deliver, I can't do it because there's no money. And then so that's the clinical part. And then I put the housing hat on, and I know why I got to have it. I got to be able to keep the doors open.
Right.
So they become in conflict with one another. And so again, supportive services.
Okay.
Having some housing, let's just, I'll go a pie in the sky. You could have some recovery housing for people who are coming out of treatment as a bridge, if you will. Okay, that has no money to pay those deposits, but you can put them there for a little while to get them started, to get a job. So they could do that. Maybe they're not ready to go to permanent housing yet. Maybe they need that next step up of housing. That's a lot of it being operated here throughout Tennessee. But there needs to be some kind of housing so that people coming out, I mean, their treatment's being paid for by the block grant. That means that's the payer of last resort. They have no money.
Right.
But we need housing for those people and don't need to have our hands tied because they can't pay it. Again, talking out the other side is, as a housing provider, I know why you got to have it.
Right.
Yeah, and I want to piggyback on that because coming, just from working in the criminal justice liaison services, I know that it gets broadcasted to use the funding that's available through our program, and we do. That's what we want to help with. But what we're facing is there's decreased availability of funds to assist consumers through our contracts. And so even as criminal justice liaisons, we're running into the same issue where, we want to help, but it might be more than what we can provide one person with financially. And then we're looking at only, do we help with that first month's rent and deposit, but then they still need clothes, but then they still need to buy food. So I think just kind of thinking ahead at some of the people who might say this might not be a need, well, we have criminal justice liaison funds. Well, no, those funds are very low right now just because our contracts have not increased money-wise, but our coverage area has increased. Salaries, benefits for employees have increased. The other thing, I think, also to speak to Debbie's point, is the demand continues to grow. So even though we have some wonderful providers who have gotten the CHI money and they've expanded what they can provide, it's still just not enough. And I do think while we need to focus on permanency, we want people to know that they are going to have a place to lay their head. We also do need that transitional piece for people to just kind of get on their feet and not have to come straight out of, Buffalo Valley or Cadiz or, wherever they've been in treatment and immediately have to start worrying about finding a job, getting around. Transportation is another issue where I think increased funding for these recovery houses maybe could even help her, cover transportation where they can help people get around. There's just a lot that goes into it that's not available right now.
And this is Debbie. And one of the, I was always known in the housing as, I don't take any moochers. If you think you're going to go there and sit on your laurels and do nothing, you're sorely wrong. Because while I am all about the supportive service piece, I don't think they need to be dependent on that. There needs to be a plan because there are more people coming behind them. So it's not, I guess my part is I wouldn't be asking for just supportive service dollars to take care of Sally Sue forever and a day. Sally Sue needs to step up and take care of Sally Sue, but she does need a bridge. And so that it's not, oh, well, we're going to just wrap our hands around them forever and a day. No, you meet them and you make them grow. You help them to grow. So it's not a long-term, let's take care of somebody. It's a bridge.
Yeah, exactly. Time limited, transitional, the emphasis on the time limited.
Okay, so Cher, what I'm kind of hearing is that that client assistance funding that CJ has is not enough really to meet the demand across the board, and that particular fund would be specific to people with CJ involvement, whereas Debbie's talking about and other folks too are referring to a broader population as one. So
Absolutely.
I just jotted a note speaking to recovery residents needing time limited client assistance to cover first month, last month's rent and deposits. Now I didn't talk about all those other things you talked about yet, the clothing, all that, but certainly we can expand that if we need to. So
I also, this is just kind of more of an ask out of curiosity more than anything, because I'm looking at the data where it talks, excuse me, sorry, where it talks about Oxford houses. But I've gotten mixed feedback. I love the Oxford House model. And of course, in Davidson County, we have many Oxford houses. But in the areas where we've done like sequential intercept mapping and talk about Oxford House, the challenges that are brought up, I'm wondering if there's a way we could look at some of the barriers to Oxford House being able to be in certain areas. Transportation has been one that has come up, like public transportation, I think specifically, and then availability of services in the immediate area. I think those are the two major ones, challenges that prevent certain regions and counties from getting Oxford House, which then creates additional housing, or they still have the housing needs. It limits the options that they're able to look at.
Keep in mind, there's no public transportation in rural Tennessee.
Right.
Right. And this is Ginger. I can just speak. Stigma is a big part of that. Getting Oxford houses into certain communities. Sometimes you can work with your transportation, if you have public transportation in your community, to swing by some different streets to get people, but that's sometimes hard to work. We had that experience in Johnson City, and public transportation did agree to come out to change their route to accommodate the house, but we tried to set up a house in Kingsport, and the neighbors, it was awful. And there is a housing shortage to even have the buildings to develop into Oxford houses, right? So that's a very real piece of it too. But that transportation piece is really bad.
Yeah.
Looking then at, so we do still need to focus on bricks and mortar, kind of like Debbie said. It's maybe some of these are hand in hand with what's happening to the mental health crowd. Bricks and mortar, but also a little more client specific assistance is needed to help people in the recovery housing to get started and move forward. Is kind of what I'm hearing from folks. Does that kind of reflect back to people? And so that's two needs in substance abuse. Do we sense a need or an opportunity to add something else? Did we want to talk about continuing to keep educational opportunities open for clinicians, especially when they focus on MAT and maybe decreasing the stigma around that, because we know some places just won't. It's just real rigid there. It just won't move.
Yeah, I'm trying to read this and compare it with the list our region has.
This is Debbie. I'll go back and say with regard to back to the housing, getting people who are on medication assisted treatment into any type of housing is extremely difficult. And I do think there does need to be some more educational opportunities to maybe to people running housing to understand MAT services. Now, they'll take them on Vivitrol all day long.
Yeah.
But they don't want the buprenorphine because there's a fear, there's a stigma. What am I going to do with this? And I can tell you, despite all my efforts, I still ain't got anybody that'll take them. So that's why I had to put them in my own housing.
Okay. I think we probably can get some good data to support like how much broader MAT has become over the last, I think we can, I think we can get some good data to support that. So hopefully.
Ginger, I'll give you an example. As of yesterday, I had 58 MAT clients in a MAT program in Clarksville, and they're all in my housing, and I don't get paid for that housing, but that's where we put them anyway, because that was the only way we could get them. They were able to access treatment, and it's luckily enough I had the inventory. So there were 58 yesterday with 4 booked coming in yesterday. So housing is important. It really is for those MAT clients.
Okay. Debbie, thank you for that. Thank you for that mission. Okay, so we need physical spaces, we need client-specific assistance, and we need opportunities to educate people to be more flexible for MAT and or to create MAT housing. So I think that will really flesh out 3 goals for our substance use needs if that is agreeable to the group.
What were the 3 again? I missed one of them.
Actually having increased bricks and mortar, but having increased supports and specific client-specific dollars, and then to really focus on MAT, educating the public and creating less stigma around that, and or creating MAT-specific housing.
If there, and I don't know how to do it, but there is one other major one, and it actually relates back to one of them up in mental health, and that is we have a major workforce problem on the substance abuse side. Being able to find staff, and so all the training and all the education is great, but I need a bottom in a chair in order to accomplish it. Right. I tried to clean it up, Ginger. But is the fact that there is a workforce development issue. And I know Commissioner was great. She put a lot of great stuff in her proposal to the governor. I'm going to be anxious to see what he takes. But I'll tell you right now, I got a nursing shortage. I got a nursing problem.
Yeah, that's so important with that population too, because the risk level is so high.
Yeah. And can I add to that? Sorry, I know I keep adding Debbie, thank you for starting the good thoughts to allow me to think also. When I was listening to the workforce updates, or the workforce work group updates, and there's a lot of emphasis on incentives, like monetary incentives, which is important because this has traditionally been a lower paying field. But also just the education piece too. I don't know, and I could be wrong, but I think when we're looking at targeting the workforce for mental health and substance use treatment, a lot of people just don't have the education around substance abuse, around severe mental illness. And I can even speak to, the programs that I went through. I mean, most of what I learned through work, not sitting in school. And so when we're recruiting people out of grad school programs, now nursing programs, they're not necessarily coming with like base knowledge around how to serve this population. And so I think what we then end up seeing is a resistance to work with this population and a sort of incompetence, for lack of a better word, in helping to work with this population.
Hey, Ginger, this is Paul at Cadus.
Hey, Paul.
How are you, Ginger? I couldn't echo more how grateful we are to have you leading this committee.
Thanks.
The commissioner had a very robust ask of the governor in her presentation, which included workforce development. I think there was hiring incentives and bonuses, and there was also bricks and mortar money. Maybe for the sake of brevity, we could kind of just revisit this briefly at the April meeting. By April, we should have a good inclination as maybe the budget will even be passed by then. And we could decide at that point whether it's wise to continue with the priorities that we have. Because I've been impressed with the commissioner's ability to put a lot of these very concerns into her presentation.
Yeah, this is Ginger. Commissioner Williams is amazing, because she has a lot of amazing folks working with and for her, right? The Avises, the Kirbys, the Amys, all those folks. My hesitation is that our next meeting is April 13th, but this is due April 1st. So and I think we'll hear all the stuff from the governor, but we'll know all that stuff hopefully by the end of February, if I'm remembering correct.
Well, it's probably going to be more like the beginning of February, but that doesn't necessarily mean it stays in his budget. It's a good sign for him to have it in there.
Yeah.
So if it's due April 1st, I just would hate for for the commissioner to feel like, why are they asking for this? I put it in the.
Yeah.
Yeah. I don't want to disrespect her in any form or fashion.
No, and I don't either, but maybe this is a support of why she put it in her budget.
Yeah.
Guys, this is Avis. Let's also think about a couple of things here. Appreciate Paul's comment, which I think he really has a good point there, and Debbie and everyone else's. But a couple of things going on here. Hopefully, we will be able to get an update at our February statewide meeting from the commissioner that she can update us on if everything is in by that time. Give us a budget update. That's number one that we're hoping that can happen. Number two, to speak to, I believe it was Shara's comment about when you have students in school or about to graduate or after graduation, they don't know a lot of information about substance abuse and mental health. And I know we have a program now that has been implemented that for, substance abuse, Monty Burks, and many of you know him, is traveling across the state. A new, excuse me, guys, I'm suffering with allergy today really bad, but he is traveling across the state, visiting a number of colleges to really make the college campus, the students, the faculty aware of number one, this profession, number two, the need for when students graduate to think about careers in these areas, mental health and substance abuse. So so just know that that is something that is going on in the department. I'm not sure everybody is aware of it, but this is something that we see the need. Also with all the things in the workforce development plan that you all heard about, I had the opportunity to read it. We may get funding to do, if not all, most of those things. So I do think it's worth listening, hearing to what that outcome is to determine whether that need will still be applicable to go on the needs assessment. So just take those things into consideration before making a final decision, even if that is whether you put it on or whether you make revisions to it to keep it on there. Just consider that as well.
Thank you, Avis. This is Ginger again. So I appreciate that comment, and maybe this suggestion will work. Maybe I can just kind of draft our notes together and kind of start to gather some data. We can all participate in the February meeting. I can tweak some things as I might see would honor the reflection of what Commissioner Williams shared. I can throw this out to everybody, and everybody has to give me feedback now. Dang it. You have to send me some feedback, and then we can tweak it a couple times that way because that will give us 4 or 5 weeks to get it all tweaked up before we turn it in on April the 1st. Would that be okay with the group?
Sure. And
Yes.
Ginger, this is Candace. If you want to schedule a time for us to get together too, like a go-to or just a phone call, let me know and I can help you with that.
Okay.
Hey, Ginger, Patrick Starnes is on by phone and he has had trouble unmuting himself. Is there a way you can unmute him? He's got some input also he'd like to share.
I think that would be a Kirby thing.
Or Kirby. Or Amy or Avis.
He needs to hit *6 on his phone.
*6. Sorry, Patrick, we didn't announce that, but if you could do *6, and then hopefully you'll be able to join us. If you're still having trouble, there you go. We got you, Patrick.
Yay.
You there? We heard you. Don't know what happened. Yeah, we got you. We hear you.
Hello. Hi, everyone.
Hey there.
Hey, I'm not going to go ahead. I'm not going to comment. I don't want to hold the meeting up any longer. But, guys, you should have seen me screaming, kicking, hollering when Shara was talking, Debbie was talking, and Evelyn was talking, because I agree to what they were saying 100% about what's going on with the mental health and substance abuse housing, and definitely the support. I'm not going to prolong the meeting, but I had a whole lot to say, but instead of talking, I started screaming, kicking, and hollering because no one could hear me. I hope everyone have had a great start to this new year. And I'll go ahead and mute myself again, and what my comments are, I'll respond to the comments whenever you send out the information for responses.
This is Ginger. Thank you, Patrick. We appreciate that so much. I wish I could have seen you kicking and hollering. That might have been fun. Well, I think with that plan in place of us just trying to work through email, And Candace, you know, your suggestion of you and I getting together, we could even open up a quick, anybody who wants to jump in call too. Is that okay, Avis, if we do that outside the structure of the regular meetings?
Absolutely. Absolutely.
Okay, so maybe we could do that. And because I do think the dialogue, you know, what Shara implied that, you know, Debbie started a string and then she was able to add on to it. And of course, Patrick wanted to add on to it, but couldn't. So I think there may be some opportunities for that synergy to help even more. So we'll work on that and move this forward. Kirby or Avis, did we miss anything that we're mandated to cover, or are we just, we're good to go?
You're good to go on my end.
I think you're good to go. This is a wonderful meeting, really, really good dialogue and discussion and some great points. And I really appreciate you all, everybody speaking up and bringing information to the table. But most importantly, I think just to echo what Ginger said is once that information comes to you, please everybody give your input, chime in. So this could be a total group effort and we can get the needs that you want included in the summary and then on to department leadership. So thank you.
Thank you. And before we check out, I do want to thank Amy Holland because she tries to capture all of this in our minutes for us. And I know there were a lot of things coming and going. So thank you in advance to Amy for working on our minutes.
Thanks, Ginger. I appreciate it.
Yeah. Okay, everybody have a great rest of the week. Happy hump day. Is it hump day? Take care. Have a good week.
Ginger.
Bye.
Thanks, everybody.
Bye.